Hi everyone, this is Tracy Koch and I'm going to lecture on Chapter 12. This is the genetics of cancer. When I do these PowerPoint lectures, I do read what is on the slide for those of our viewers who might be visually impaired. I also will add some content audio-wise, and that I will say that you can capture that with a closed caption setting on your YouTube. So it may be a little redundant to hear me read the slides, but I'm doing that so that everyone is able to know what's on them. This chapter, Chapter 12, The Genetics of Cancer, focuses on the internal and external events that result in cancer development through the alteration of activity of suppressor genes and oncogenes. And we will talk more about those terms as we go through the lecture. So, which statement is true? All cancer is genetic. All cancer is inherited. We know that cancer involves changes in genes that regulate cell division, so yes, all cancer is genetic. As far as inheriting cancer or the risk of cancer development from one's parents, it is not the case for most cancers. So all cancer is genetic, but not all cancer is inherited. Well, let's look at some cancer facts. All cancer is genetic in that it is always caused by changes in the expression of genes involved in cell division. Cancer cells transmit gene changes from one cell generation to another, but cancer is not inherited from one human generation to another. So the most common mechanism of malignant transformation involves suppressor gene mutations with unregulated oncogene activity. Aging is the biggest risk factor for cancer development, and remember that all cancer cells at one time were normal cells. There's a few more cancer facts. Specific mutations in genes regulating cell division that occur in germline cells can be inherited from one human generation to another and greatly increase the risk for cancer development. Cancer is a disease of cells. Cancer arises from normal cells that have been altered at the DNA level. So anything that can damage a normal cell's DNA and not destroy its ability to reproduce can transform that normal cell into a cancer cell. So things to remember are that cancer is a disease of cells. The loss of function and changes in appearance is what happens to a cell as it transforms into a cancer cell. So anything that can damage a normal cell's DNA and not destroy it, and it still has the ability to reproduce, can transform that normal cell into a cancer cell. Cancer facts. Even one cancer cell is capable of generating widespread metastatic disease. That is the monoclonal origin of cancer. Cancer develops as a result of three interacting factors: environmental exposure to carcinogens, the health of the immune function of the individual, and genetic predisposition. So although some cancers are inherited through the mutations passed on at conception, most cancers are a result of environmental, so both your internal or personal environment and as well as the external environment. So it's a result of the environmental exposure to substances or events that lead to gene damage, and then therefore cell changes and cancer. So let's look at some of the characteristics of normal cells. Normal cells are very orderly. They are well regulated. Their growth is well regulated. They have a specific morphology. Their small nuclear cytoplasmic ratio, so the nucleus to the cytoplasmic ratio is small. They have differentiated functions. They're tightly adherent, they're non-migratory, They're euploid, which the cell contains the normal number of chromosomes for the species. That's what euploid means. And they respond to signals for apoptosis. And apoptosis is the programmed cellular death. So these are characteristics of normal cells. So early embryonic cells, so characteristics of early embryonic cells: rapid continuous cell division. They re-enter the cell cycle immediately after mitosis. Anaplastic morphology, so they're all small and round. They have a large nuclear to cytoplasmic ratio. No differentiated functions. They are loosely adherent, so no CAMs present. CAM stands for cell adhesion molecules. They are able to migrate, and they are euploid. They only feature in common with mature differentiated normal cells, so they are also euploid like a normal cell. And you will recall that euploid means that they contain all the normal number of chromosomes of the species. Okay, so the next slide is characteristics of benign tumor cells. So these are benign tumor cells. They do not share most of the characteristics of cancer cells. They retain most of their normal characteristics. So these would be cells like in uterine fibroids or lipomas. The characteristics of benign tumor cells are specific morphology, small nuclear to cytoplasmic ratio, differentiated functions. They are tightly adherent, non-migratory. Usually they are euploid. Continuous or inappropriate growth but not needed for normal function, and they grow by expansion. They do not invade. So this is one key difference. Keep that in mind, that benign tumor cells grow by invasion and they do not invade. This next slide lists the characteristics of cancer cells. Cancer cells are rapid, continuous cell division. They re-enter the cell cycle immediately after mitosis. So they are rapidly dividing cells. They do not respond to apoptic signals. They don't have that regulation of normal cell death. Genetic regulation of the cell division is lost. They are anaplastic morphology, so they are all small and round. They have a large nuclear to cytoplasmic ratio. They have no differentiated function. They are loosely adherent, so they have no CAMs present. They are able to migrate, and they are usually aneuploid. So cancer cells are rapidly dividing, and they don't die. So in remembering that cancer is a disease of cells, we know that these cancer cells arise from normal cells. Normal cells that are exposed to a personal and environmental condition that make it possible for the cellular changes to occur. Carcinogenesis or oncogenesis is the transformation that occurs in which cancer develops. So the carcinogen, or a substance that is capable of causing this genetic mutation or mutations, the cell is exposed to it, it leads to cancer development. Something to remember is that cancer cells are always abnormal. They have no useful purpose. They invade normal tissue and organs, and without treatment will lead to death. Okay, moving on to the next slide. Anaplastic morphology. So this is a characteristic, as you'll recall, of the cancer cells. So what that means is that these are progressively loose parent cell features. They become small and round. They all look alike, even among many different cancer types. They have a small nuclear to cytoplasmic ratio. This is a picture of cancer cells. And as you can see, in this photograph, there's a ball of cells kind of encircled in white. So it's actually a pile of hundreds of cancer cells over here on this area. These cells have no fibronectin, and so even though they pile up, they're really loosely adherent. So it means that it's really easy for one cell or group of cells to break off from this main metastases. So for many types of cancer, it's the metastatic disease that actually results in death. So for example, if you have breast cancer and it just remained in the breast, it wouldn't result in death because breast is not critical tissue. But the fact that breast cancer metastasizes to the brain, bone marrow, lungs, and liver, which are vital organs, make it fatal. Some other features of cancer cells: the loss of parent cell differentiated function. So remember, cancer cells have no normal function. They stop producing cell adhesion molecules and gain lytic enzymes on the cell surfaces. So there's tumor breakage and release of the cells into the bloodstream. So these are, again, loosely adherent, and they travel and metastasize. Other cancer cell features: the tumor cell migration and invasion into other tissues, metastases. They gain metabolic and selection advantages that allow the cells to continue to grow when host nutrition is poor, and all are related to gene alterations. This is another picture of tumor cells. Most tumor cells have, these are actually pictures, of the chromosomes. So most tumor cells have abnormal chromosome numbers or structures, and that's called aneuploidy. Aneuploidy. For the most part, the more highly malignant a cell is, the more aneuploided the chromosomes will be, so the more abnormal the chromosomes will be. Some of the chromosomal rearrangements are used for diagnosis and prognosis. So about 90% of the CML leukemia cells have the Philadelphia chromosome, so it's a broken number 22 chromosome. And that is shown down here. And the Philadelphia chromosome is considered a diagnostic feature for CML. So additionally, with CML that is Philadelphia chromosome positive, it's more responsive to therapy than those that do not express that Philadelphia chromosome. I know that's a little bit confusing, but the patients who have that Philadelphia positive CML are more likely to respond to the drug Gleevec as their cancer treatment. So by identifying this chromosomal abnormality, you not only diagnose the cancer, but you also can identify which ones are going to respond to therapy. That's an important part of cancer treatment. So let's talk a little bit about malignant transformation. Malignant transformation, the process of changing a cell from a normal phenotype to a malignant phenotype. It occurs in a stepwise, time-dependent, well-characterized progression. It involves cell alterations at the gene level. So now, knowing the characteristics of normal cells and remembering the fact that our cancer cells arise from normal cells, we need to look at this conversion of a normal cell to a cancer cell and what processes are involved in this transformation. So this is the genetic level of cell alteration. Our next slide shows us in a little graphic how this happens. Okay, malignant transformation is the conversion of a normal cell to malignancy. So this conversion does require some time and changes at the gene level. In addition, once the changes begin and the conversion has happened, the cancer cell progresses down the malignancy pathway. So this means there are different degrees of malignancy. So you can see the mutational event happens with a normal cell. You have a latency period, this continuing exposure to promoters, and then the conversion to cancer cells. We will come back to this diagram and explain these steps throughout this lecture. Okay, so these are the steps in cancer development. This is in your textbook. You have a normal cell. You have some alteration or cell dysplasia. Promotion leads to the tumor. More promotion increases the degree of malignancy, and then the promotion to metastases, and this is a progression over time. So these are your steps in cancer development and malignant transformation. First step is initiation, and this is the damaging of the DNA directly or indirectly by agents or conditions resulting in a permanent alteration of gene expression that does not interfere with the altered cell's ability to reproduce. So remember back in the beginning of the lecture we said it's a normal cell, changes, but it doesn't affect its ability to reproduce. That's important because if it affected its ability to reproduce, we wouldn't have to worry about it affecting more cells. Okay, so common initiating classes of agents are chemicals, physical, things like radiation, and biological, like viral infections, unrepaired spontaneous DNA replication errors, or inherited DNA mutations. So the initiation results in a permanent gene mutation or changes. So it's permanent, it may not lead to cancer development depending on what else happens in this initiated cell. So initiation is kind of a prerequisite for cancer development. It does not guarantee that it will occur, but you have to have it in order for cancer to develop. So in addition to being permanent gene mutation for the initiated cell, initiation can only lead to cancer development if it does not impair the cell's ability to divide. So what I think when I think of initiation, it's sort of the first step to cancer development. You can't reverse it. It's always there, but it may not progress any further. That's important to remember. Mutations in genes regulating cell growth lead to cancer development. So earlier in our discussion we talked about the normal cell that has the mechanism that inhibits growth and cells have a programmed death. In cancer cells, this is not functioning and there is no regulation, so this is a key concept to remember. All right, so oncogene products, including cyclins, are the car's accelerator, and your suppressor gene products are the driver and the brake. So this little analogy with the race car is excuse me, sort of helps me to remember. The oncogenes are produce products that promote cell division, and an oncogene is an abnormal gene that predisposes cells to develop into cancers. It's altered in such a way that they're stuck in a state of constant activity, and this drives the uncontrolled growth that underlies the tumors. So oncogenes are the accelerator. And then your suppressor genes will be the driver and the person putting on the brake, or the brakes in the car. Suppressor gene products regulate cell growth, limiting, inhibiting expression of oncogenes, and inducing apoptosis when needed. So here are some examples of suppressor genes. And this is also listed in your textbook. So suppressor genes will either keep the proto-oncogenes in a turned-off state or prevent their overexpression. The major cause of cancer is a damage to the suppressor gene so that it cannot perform its suppressor functions. So you can see this is kind of layering on some very complex issues. You have the initiation, but you also have these suppressor genes that regulate cell growth. So if your suppressor genes are working or functioning properly, they will keep things going, or keep things from moving to the next phase or progressing. So back in the little race car analogy, your suppressor genes, so the examples of these in the box are the brake and the driver of the race car analogy. So these things will help to keep these oncogenes from expressing and progressing. Suppressor gene mutations and associated cancers. So this chart is also in the textbook. APC is the colorectal, stomach, and pancreatic carcinomas. ATM, not where you get your cash, it's the breast, stomach, bladder, pancreas, lung, and ovarian carcinomas. BRCA1 and BRCA2. Those are breast, ovarian. The BRCA1 is the genitourinary and gastrointestinal carcinomas. The BRCA2 is ovarian, breast, and prostate. DCC are colorectal carcinomas. RB1, retinoblastoma, sarcoma, bladder, breast, esophageal, and lung carcinomas. PTEN are breast, prostate, and uterine carcinomas, melanomas, brain tumors, such as glioblastomas and astrocytomas. TP53 are bladder, breast, colorectal, esophageal, liver, lung, ovarian, and CNS carcinomas, lymphomas, and leukemias. And WT1 is the Wilms tumor. And I know it's a little tedious to have those read off to you, but again, I'm doing that for anyone who visually is having difficulty reading the slide. This next slide is another graphic talking about the oncogene expression and your loss or mutation of suppressor genes, leading to your cell growth and proliferation, and then again, possible cancer. The blue box here, these are your suppressor genes. If you have an overexpression of these oncogenes, your suppressor genes are either mutated or lost, and that leads to the cell growth, proliferation, and possible development of cancer. So this is the process of malignancy. BRCA1 is normally a suppressor gene in both genders, so its function is to control the expression of many kind of oncogenesis. It really has no role in normal breast development. Okay, so I'm kind of stuttering here a little bit. It's time for a quick break, and we'll pick up on the next slide. Okay, and we're back. Let's head down to the next slide here. Oncogenes. Normal genes that regulate cell cycle, the code for cellular proteins that relay signals to the nucleus. Signaling process begins at the cell membrane, and it relays the system of signals through intermediaries in the cytoplasm. They end in the nucleus with the activation of transcription factors that help move the cell through the growth cycle. So oncogenes sort of do some signaling, and it starts all the way at the cell membrane, working its way through the cytoplasm and ending in the nucleus. Pro-mitotic, or promoting duplication of cell division that results in two new identical cells that is also identical to the parent cell, is something that the oncogene will do. So this is some example of pro-mitotic oncogene products: cyclins, aurora kinase, and various cyclin-dependent kinases. So suppressor genes will produce these products that control cell division and regulate the oncogene activity. Your suppressor genes will keep these turned off. And here again is another chart. The DNA repair gene mutations and associated cancers. So the MLH1 is hereditary non-polyposis colon cancer. MSH2 is hereditary non-polyposis colon cancer, such as Lynch syndrome. MSH6 is hereditary non-polyposis colon cancer, and you can see a list of other ones below that. And PMS1 is hereditary non-polyposis colon cancer, and PMS2 is hereditary non-polyposis colon cancer, glioblastomas, leukemias, and lymphomas. The major defect in carcinogenesis is the inappropriate and excessive oncogene expression, regardless of the specific cause or where it's coming from. Okay, here are some cancer facts. Mutations in suppressor genes, even in one allele, reduces the ability of the suppressor gene products to inhibit the activity of the pro-mitotic oncogenes. Mutations in suppressor gene alleles or DNA repair genes cause most cancer development. Mutations in oncogenes, although occurring less frequently, result in the loss of oncogene sensitivity to suppressor gene regulation. Both types of mutations lead to oncogene overexpression. So here we have our race car again. initiation in cancer development is the mutating of the DNA cancer cell, or mutating of the DNA in the cell. So either the suppressor genes cannot perform the regulating cell growth, or oncogenesis becomes resistant to the suppressor gene. So here it looks like everything's working okay. Here it's getting a little bit iffy in diagram B. It's getting closer to the trees. And here you can see the suppressor genes have just completely stopped functioning. So the car can't stop and it hits the trees. So the next step, if we go back to our original graphic up here, this shows the initiation and then promotion. So next we're going to talk about promotion. Promotion is the enhancement of expression of the gene altered during initiation. Promotion usually increases the growth rate of the cells and is a reversible event. Promoters can be external to the cell or internal, such as enzymes, hormones, and natural growth factors. So this is the other event that is needed for transforming an initiated cell into a cancer cell. It needs to be exposed to a promoting agent or a promoting environment. Promotion must follow initiation for cancer development to occur. If promotion precedes initiation, cancer development cannot occur in that particular cell. Promotion appears to be substances or environments that promote an increased rate of cell division of the initiated cells. Some hormones, such as estrogen, are considered to be promoters. They allow the expression of gene alteration that occurred during the initiation. The other thing to remember about promoters is that they are not permanent. Initiation is permanent, but the promoters are not. And here we are back to our diagram, and you can see the exposure to the promoters down here. Promoters increase your growth rate and potential of the initiated cells and enhances the growth of such cell. Malignant transformation is the conversion of this normal cell to malignancy, and the conversion does require changes that occur over time and changes that occur at the gene level. So once the changes begin and the conversion has happened, the cancer cell progresses down this malignant pathway, and that means there are degrees of malignancy. If your promoter, which is temporary, if it isn't strong enough or the exposure isn't long enough, this actually may reduce the chance of the cancer ever developing. Okay. Progression. Progression is the continuing change over time of a cancer cell population, causing them to become more malignant, more aggressive, and less normal in appearance, function, and growth regulation. This results in increased growth rate, increased invasiveness, metastases, biochemical changes, and morphological changes. Metastases is the ability of cancer cells to invade other tissues and organs, forming secondary tumors, either by direct extension or by separation from the original tumor. Circulation, lymphatics, implantation, and invasion are all examples of metastases. So by reducing or eliminating the fibronectin from the surface of the cancer cells, so that was what kind of keeps them together, and remember they're really loose and not very adherent. So it makes it easier for the individual cells and clumps of cells to break off from that primary tumor and directly invade nearby tissues or enter the bloodstream and then invade distant tissues. This is known as, well, this is metastases or cancer spreading. So many cancers, if they didn't metastasize, would not cause death. So if they were limited to just the tissue, such as breast cancer. So if we could find a way to control the limit metastases, there might that is a way that we could have treatments that would help with cancer being less fatal. Sorry, stumbling over that a little bit. So remember, your benign tumors grow by expansion and they don't invade, and your metastases is that special ability of these cancer cells to invade. Okay. So we're going to go moving on into different kinds of cancers and different classifications, I guess I would say, of cancers. The first one is sporadic cancer. Sporadic cancer is cancer that occurs usually as a result of environmental exposure or unknown factors. There is no observable pattern of inheritance within a kindred. Mutations through carcinogenesis disrupt regulation of cell division, usually somatic cells, and it is not present in higher than expected levels within 3 family generations. Sporadic breast cancer occurs without any observable pattern of inheritance. It is not present in a family at higher than expected levels, so less than 1 out of 8, and affected individuals are all post-menopausal women. So this is a typical family pedigree showing sporadic breast cancer. So there's no real pattern of inheritance or observable pattern of inheritance that you can see with this. Familial cancer, cancers that occur at a higher than expected frequency within a kindred. So this is familial. It does not demonstrate any observable pattern of inheritance. A family may have a higher than expected incidence of several cancer types, and those who develop the cancer are usually older. So we're going to say usually older, over 60. Familial breast cancer. It occurs without any observable pattern of inheritance. It's present in a family at a higher than expected level, so greater than the 1 out of 8. Family may also have a higher incidence of other cancer types, and affected individuals are all postmenopausal women. And here is a family pedigree showing you familial breast cancer. So higher incidence for sure, and occurring in older individuals. Okay, moving into hereditary or inherited cancers. I think this is what most people are interested in when we think about genetics and cancer. Even though we've been talking about the genetic changes that take place at the cellular level when genetics and cancer are addressed, what comes to mind for most people is hereditary or inherited cancers. So hereditary inherited cancer are cancers that occur with an observable autosomal dominant pattern within a kindred. Diagnosis is at a much younger than expected age, caused by germline mutations in the suppressor genes. Risk is inherited, but not the actual cancer. Risk is greatly increased, but not in absolute. So those are important key things to remember. The risk is inherited, not the actual cancer. The risk is greatly increased, but not in absolute. So although some cancers are inherited through mutations passed on at conception, most cancers are a result of your environmental, internal and external exposure, environmental exposure to substances or some kind of an event that leads to gene damage. Hereditary breast cancers have an observable autosomal dominant pattern of inheritance. It's sort of redundant from the last slide. It's present in a family at much higher than expected levels. It's often associated with other cancer types. Affected individuals are women and men of any age. Women more so than men. So the process of initiation you have of one allele occurs at conception. So essentially you're already about halfway there. So through initiation you require the additional allele mutation, but you also have to be followed by promotion for the malignancy to occur. So just because someone has the genetic inherited tendency or the inherited allele does not mean that cancer is going to develop. So I think that's something really important to talk to people about and to keep in mind when discussing hereditary breast cancers. Okay, and the hereditary breast cancers are bilateral diseases. This is a, excuse me, this is a pedigree showing an autosomal dominant pattern of inheritance for an inherited cancer. So you see it's in multiple successive generations. Half of the children are affected on the average. Half of the children of the affected individual are affected on the average. So I think that was a little confusing the way I kind of said that there. Okay, so this is a case study, and I think I'm going to go ahead and read through it. This is a little different than the one in your book, but I think it might help you with the concepts that are in the case studies, or the case study for this particular chapter and this exercise. So we have Barbara, who is 56 years old, and she has 2 daughters and 1 son. Oh, sorry, her name's not Barbara, it's Belinda. Belinda is 56 and has 2 daughters and 1 son. She's just been diagnosed with a recurrence of lobular breast cancer treated by a lumpectomy and radiation 4 years ago. So she had her initial diagnosis 4 years ago. She was diagnosed with a recurrence. Her father, Aaron, is still living at age 82, and her mother, Ann, died of ovarian cancer at age 36. Ann was diagnosed at age 34. Her sister, Bonnie, was diagnosed with breast cancer 6 years ago at age 32 and died 2 years after diagnosis. She was married and has no children. Her brother, Brett, now age 45, underwent surgery and chemotherapy last year for breast cancer. He has 1 son and 1 daughter who are teenagers. Her mother had 1 sister, Amy, who died of abdominal cancer when she was 34, and 1 brother, Alan, who died of bone cancer at age 41. Her father's twin brothers died at Bergen-Belsen during World War II. Belinda's daughter, Connie, is 30. Oh, actually, her daughter's Caroline in this one. There's a discrepancy in my book and in this pedigree, but Caroline is 30, recently diagnosed with breast cancer, and she has 2 sons, ages 1 and 3 years. The other daughter, Catherine, is 32, and the son, Carl, is 26. Neither Catherine or Carl have any evidence of the disease. So we have Belinda. We have Caroline, who is affected. We have Bonnie, her sister, and Brett, her brother. And we have Anne, her mother, and 2 of her siblings who are also affected. So this pattern of inheritance is an autosomal dominant pattern. We see that males and females are affected in nearly the same proportion. Affected individuals have affected children, and transmission is from parent to child. So, who in this kindred would we think about would benefit from genetic testing at this time? Well, genetic testing could be beneficial for Belinda as well as Brett. Caroline, Catherine, and Carl also would benefit because if they're positive, they could still develop cancer. And if Belinda has the mutation, each of her children has a 50% chance of inheriting such a mutation, and they could develop breast or ovarian cancer. Of course not Brett, the ovarian. And 1 daughter has already, Caroline, has already had ovarian cancer, and is continuing risk for breast cancer. So she is very likely to be positive, and each of her children has a 50% risk for inheriting the mutation. You can see Caroline has 2 children as well. So who would you test first if we were going to talk about testing, genetic testing for cancer? I would probably test Belinda first, since she's the one with the disease. And she's still living. Okay, so let's move on to the next. This is a pedigree of another family, and we can see we have 3 generations. We have Martin here, who is 68 years old. He was diagnosed with colon cancer. His sister, at age 65, was also diagnosed with colon cancer last year. They have a maternal aunt at age 90, and a paternal aunt at age 75 who had breast cancer. One maternal uncle at age 72 had colorectal cancer, and one paternal uncle has prostate cancer at 75. A maternal great aunt died of childhood leukemia at age 12, and a second maternal great aunt of breast cancer at age 69. A maternal great uncle died of lung cancer at age 64. So here is your pedigree for this family. So is there a pattern of inheritance for this family? Well, gee, we have a lot of cancers involved, and there really is no clear pattern of transmission. There are a number of people in this kindred who have various types of cancer. It's greater than what would be expected by chance alone. So the best identification would be familial cancer. So no one really meets the criterion for any kind of genetic testing for a known mutation for risk of cancer at this point in this particular kindred. All right, so this concludes our lecture for Chapter 12. I hope that you got some useful information from this. Certainly, there's a case study to be completed, and I think going over these patterns of inheritance here on these last 2 kindreds should be helpful for you. Things to remember that I will leave you with: cancer develops because of carcinogen exposure, immune function, genetic risk, and age. So it's all influenced by those factors. And remember, cancer is a disease of the cells. We start with a normal cell, and through initiation and promotion, over time, cancer develops in these cells. Should you have any questions about this, feel free to email me at tacoke@lcsc.edu. Have a great rest of your day.